Hello everyone, today I'm going to give you my review of a summer meet in Tijuana, Mexico. So I had VSG surgery there on January 7th, 2021 with Dr. Andrade. I had a great experience from the coordinators to the driver at the airport to the pre-ops and everyone who did my EKG and my blood work. Everything went smoothly. Everyone was very nice. Everyone was very knowledgeable. So on January 7th, January 6th, I arrived at the airport in San Diego. I did have a friend with me, or a companion as they call it. Our driver picked us up you go right out the door, and the concrete is marked with zones, so it's super simple. Walked out, text the driver, told her what zone I was in. She was there within minutes. It was smooth sailing. Got into the van. I met my surgery sisters there in the van. We went to a hotel, picked up a couple more people, a couple more ladies who joined us to go across the border. I think there were 2, 3, 4, 5, 6 of us in the van and the driver, so 7. We went across the border with no problem to Tijuana, Mexico. We drove to the clinic first, where we had blood work, EKG, urinalysis, pre-op, your normal pre-ops there. They gave us a t-shirt, a mask because of COVID, which I had already had a mask, and before I forget, you have to have a COVID test before you go. I did anyway at this time, and so did my companion. So we got all that done, got all the pre-ops done. Then they drove us to the hotel, which is literally just right down the street from the surgical center where you do your pre-ops. Also, there's a pharmacy right next door. A lot of people ask about the pharmacy. They want to buy extra medications. That is right next door to the surgical center, and I actually went there and got some vitamins and vitamin B shots and an iron supplement that I could drink. I got them there at the pharmacy in Mexico, and it was no problem putting them in my suitcase and taking them across the border. And on the airplane, it wasn't a problem. So after the pre-ops, all that, they drove us to the hotel, which is literally, you could walk, and a couple of girls did walk down to the city suites where we stayed the night there. I do highly recommend for your broth that you can have that night before you have surgery. There is, across the street from the hotel, there's like a little station, a convenience store. There's a Subway, there's a Mexican food restaurant, and then there's a Japanese restaurant. They have the best miso soup and the best broth there. Oh, it was delicious. So rather than Jello or what have you at the hotel, they did have free Jello and broth. I didn't care for the broth at the hotel, so the miso soup broth was delicious. So I highly recommend that if that's where you're going. The hotel was clean, it was comfortable. There was hot water. I've read a lot of complaints saying the hotel didn't have hot water. There was hot water to shower. I took a bar of Dial soap to shower the night before and the morning of surgery, just in my own experience of surgeries that I've had in the United States. They want you to bathe with an antibacterial soap such as Dial, so I took that upon myself. That wasn't recommended, or it wasn't told to me. So then my companion and I watched some TV, which there was only one channel in English, so maybe take a Fire Stick or something. They do have Wi-Fi there, a Roku stick or something if you want to watch TV. The one channel didn't really bother us. We just talked most of the night and played on our phones anyway. So then the next morning I got my second shower with the antibacterial soap. The driver picked me up. I went back to the clinic where I had done my pre-ops. The surgical center is upstairs. So you just go up a few stairs, go in. It was clean. It was organized. Everyone was sweet. Everyone was kind. They took me to my pre-op bed, gave me my gown, hat, and compression stockings. So I changed into those. I met I had a surgery sister that I had met in the van. Sorry, she was actually, there's a curtain dividing the two. She was actually next to me, so we kept the curtain open where we could chit chat. And she went into surgery, and I was like, "Good luck, I'll see you," And then I had gone, and then my other surgery sister had gone. So when I went into the surgical room, oh wait, let me back up. Sorry. So I got my bed, got my gown, my compression socks. You get a little bonnet for your hair. The nurse gave me an IV. She was very sweet. I loved her. Her name was Michelle. I loved everyone there. Her name was Michelle. She's super kind, explained everything to me. I got my IV. I was kind of just laying there waiting. I FaceTimed my family, told them, that I was there. Everything was going well. I was just getting ready. And then Dr. Andrade come out to speak to me, run me through the procedure. We took a selfie. I don't know. So I wanted the selfie. Anyway, he's super kind, super sweet, very knowledgeable. Walked me through the whole thing, answered all of my questions, and I ask a ton of questions. I have questions. So he answered all of my questions with no problems. Then when it was my turn, they came, they said, put your belongings here. So I had my personal clothes, I had my wallet, my purse, my cell phone. I just left it all on my bed. And when I got out of surgery, it was all still on my bed. I know that is a big question of people have. What'd you do with all your stuff? It was there. It was there for me. They actually put my clothing in a bag for me. My purse, I didn't even zip it up. I was FaceTiming, and I just dropped my phone into the top of my purse and went to surgery. No problem. So then you go, you walk into the surgery room. They give you some booties to put on your feet. I sat on the surgical bed, and then the anxiety, and I was like, oh my gosh. And I turned around and I looked at the anesthesiologist and I said, I'm getting nervous. And she was so sweet. She had put something in my IV, and she's like, you're gonna be okay. And then I was like, oh yeah, I think I feel okay. So then they have you lay back, and I'm looking at her, and the next thing I know, I was waking up. Everything went smoothly. Now, I don't do well with anesthesia. I wake up fine. It just makes me sick to my stomach. So having the sleeve gastrectomy, having 85% of your stomach removed, and then having an upset stomach, that was not fun. But we made it through. So I have to back up and get my train of thought. So when I woke up from the anesthesia, I was in the recovery area. I woke up, I heard, just coming out of anesthesia, and then I heard the voice of the nurse, Michelle, who I had, and I said her name, and I was like, I did it. And she said, you did it. So after I woke up a little bit more, they took my bed next to the bed that I was in previously, and I scooched in there, did some recovery there, got some IV fluids, did some walking, went to the bathroom, and then went to the recovery house later that evening. So my surgery was at like 11 or 12 that day. It might have been a little bit later. I can't really remember. It might have been a little bit later. I did go to the recovery house that night. So the van took me there, and that was fine. The same driver that had picked me up from the airport. She was very sweet. At the recovery house, I had a nurse named Stephanie, and she was very kind as I was upset to my stomach pretty bad that evening. They give you a medication for nausea. Then there's also a pain medication in your IV. You get quite a bit of IV fluids, which you need because you just sip. I had some Gatorade. So that night was kind of rough, walking around, trying to get my stomach to settle. The next morning was much better. The recovery house, there are 4 rooms downstairs and a nurse, and then a kitchen, and 4 rooms upstairs, a nurse, a kitchen, 2 bathrooms, 2 bathrooms upstairs, 2 bathrooms downstairs. So myself and my surgery sister, we shared a bathroom, and then on the other side of the house, there was 2 rooms, and they shared a bathroom. And you could kind of walk from our rooms, you walk through the living room, like past the stairs, and then you could walk, and we just made kind of like circle 8s, just walking the gas out, and the gas was the worst part. That was the worst part for me, was that gas from anesthesia. So the next morning, day after surgery, then we got the van came back to get us and take us to get the van came back to get us and took us, excuse me, to get a leak test. The barium is disgusting, but other than that, it was smooth, flawless. I went in, the driver of the van gave the personnel there our information, our names. They called us back. You take a big gulp, which is hard to do. You know, take a big gulp, they take a picture, and then you have to take a second big gulp, and that second big gulp did not hit me well at all. I had already been nauseous from the anesthesia, so I had the cup, and he took the picture, and I looked at him, and I said, I can't hold this down anymore, and he said, it's okay, you know, we got our picture, and I literally had to like spit up a little bit in the cup, and then he took me right to the bathroom. So that was kind of embarrassing, but I'm never gonna see him again, so sorry I threw up in front of you. It was just a little bit of, ugh, that barium, it was just gross. And then back to the recovery house. We went and watched TV. The recovery house did have a lot of channels in English, so that was good. Shift change came, and I had another nurse. I can't remember her name, which is really sad. She was super sweet. Felipe, maybe? I really liked her as well. Super sweet. I did tip the driver. I did tip the nursing staff. And the nice sweet lady that cleaned my room and the bathroom, and I guess it was her grandson. He was probably maybe, I don't know, 17, 18. I did tip the both of them as well. They were super sweet. So that next day after I got back from the barium swallow, the leak test, the hotel driver dropped off my companion because she stayed in the hotel a second night while I stayed my first night in the recovery house. So they did bring her to me, dropped her off. And she did carry snacks and stuff in her bag, although you can get like Uber Eats there, or stop and grab something from the hotel to the recovery house. But she just brought some little snacks in her bag. She didn't really want to eat a full meal, I guess. I don't know, I kind of felt bad, but she said, don't worry about it. So then she got there and she would walk with me and put my shoes on because I did not bring slip-on shoes. Take slip-on shoes or house shoes, something to walk, because you're going to want to walk that gas out. So I had tennis shoes on, so I just felt like, you know, she had put my shoes on so I didn't walk down the backs of them, you know. For my suitcase, I took just a regular carry-on suitcase, you know, that zips all the way around, looks like a rectangle. I can't think of the size of it right now. It was just a carry-on that you put above your seat in the airplane. And I packed super, super light. So I packed a 10-foot extension, no, a 10-foot phone cord, no extension cord. I know if you go to a Slimmer Me, they'd say you would want to bring an extension cord to plug your phone in. I didn't need that, just the 10-foot charger, and I got it on Amazon for an iPhone, and I'll try to link it at the bottom here. So I took that with the charger box, of course, some earbuds for the airplane ride. In my bag, I took a couple pair of undergarments, socks, 2 extra pair of yoga pants, 1 t-shirt, 1 sweatshirt. Is that right? Yes. Yes, that is correct. And the only reason I took 2 pair of extra yoga pants, because I was just nervous if I sat in something. Like if I got something on my shirt, I had a shirt under it, so I always wear a t-shirt and a sweatshirt or a hoodie. So the clothes that I wore down there was a t-shirt, a hoodie, and yoga pants. I wore those down there and did all my pre-ups, and then I wore them home as well. So maybe I just took the 1 extra pair. I took the 1 extra pair of yoga pants. So just 1 extra outfit because I wanted to pack really light. I didn't know what to expect. You know, you get a med pack, and I wore the hospital gown the day of surgery. And then the day after, I had my extra outfit, and the day I came home, I wore the same outfit that I had worn down there. And I'm glad I did that, because I did have the extra medication that I bought at the pharmacy. I did have the med pack that I got from a Slimmer Me. And then I did some shopping. I got a couple of blankets, I got a scarf, I got a purse, I got a poncho. Like I got some stuff, and it all had to fit in my suitcase. So since I had such a small amount of personal items in there, it fit perfectly. As far as cosmetics, I didn't take any cosmetics. I took a hairbrush, an extra ponytail holder, my toothbrush, my toothpaste, floss, face cream, because I didn't want my face to get dry, and chapstick. And the Dial antibacterial soap. I took those. And that's basically all the hygiene. Oh, shampoo. And they do have shampoo at the recovery house. And the recovery house also has hot water. I read a couple of reviews that said that they didn't have hot water. I had hot water, and everything went smoothly for me. So, okay, that was the day after surgery. So that next day, let's see, I came home on a Sunday, right? I can't remember. I can't remember what day I came home. So I had surgery, and then the third day that I was there, then Dr. Andrade came to the recovery house to see me. Let me get the exact date. He came to the recovery house to see me, and I met Dr. Gabby, and she is super sweet and kind as well. Okay, so I had surgery on a Thursday, then the leak test on Friday. Saturday is the day I went home. Got there Wednesday, surgery Thursday, leak test Friday. Friday night, Dr. Gabby came to see me, which is Dr. Andrade's like assistant. She came to see me. She also came to see me Saturday. Friday evening, Dr. Andrade also came to see me. He gave me some information about what to expect in the future, spoke to me, gave me a little bit of diet information, like try to keep it under 40 carbs a day, stuff like that. And then Dr. Gabby took out my drain, because I have 3 incisions. So I had 2 incisions and then a drain, which I call an incision. So I had 3, 2 incisions and a drain. Dr. Gabby took the drain out, no problems whatsoever, and I still am in contact with her. She is super sweet. And then we got on the shuttle to go back to the airport at 8:30 Saturday morning. It took about an hour to get through the border this time. Also, I did some shopping at the border, because people just come right up to the van, and they have some really cool stuff. So getting through the border took about an hour this time. They had us pull over, and then took everyone's documents, and then we were on our way. And there was, 7 of us, so it just took a minute for them to read over our documents. I had a driver's license and a birth certificate, and did not take a passport, and I had no problem. And a lot of the girls that were on in the van with me also only had a driver's license and a birth certificate, no passport. My companion did take a passport and her driver's license, but birth certificate, driver's license, you'll be fine. So went back through the border, got back to the airport in San Diego. On the airplane, I had to take 2 flights home, 2 couple-hour flights home. I was gonna say 2 2-hour flights home. I got home late in the evening. I was perfectly fine. They give you a pain medication, which is equivalent to a Tramadol. They give you a anti-nausea medication, blood thinners, an antibiotic, and your omeprazole is in your med pack. I didn't have to take the nausea medication, so I didn't need that. And I think I only took 2 of the pain pills, and it was more out of fear of pain than actual pain. So once I took those 2, I didn't, and you don't take 2 together. I took them at 2 separate times. But after that, I didn't need them. I wasn't in any pain. The most pain that I had was from the gas that they blow up your abdomen with to actually perform the surgery. So everything went smoothly. Everything was fine from pre-op to now. And today is March 17th, St. Patrick's Day. So happy St. Patrick's Day. And I did eat a little bit of a corned beef. Is it corned or corn? Corned beef and cabbage. I don't know. I did have some of that today. So if you have any questions about anything, just put it in the comments below. I'll do my best to answer. And then stay tuned because we are going to have so many videos coming. We're going to go through this process together. I know I'm a little late starting because I am, 8 weeks out, but I wanted to make sure everything was okay and that I got a good clean bill of health from my doctor before I started bringing everyone information, and I have done that. So I've gone to my doctor here at home, and he's amazed at my results, and my incisions look incredible, and he just is very supportive, and I'm gonna get some vitamin levels drawn in a couple weeks at my 3-month mark, so stay tuned for that. We'll see. And if you want to know what kind of vitamins and everything I'm on, I could do a video about that. Just let me know. Other than that, if you are searching for a place in Tijuana, Mexico, I recommend A Slimmer Me, or ASM as they're called. And I did a lot of research before I made a decision. I had the basic package, which was $3,200, and then I bought the med pack of $150. So the basic package, I didn't feel a need for anything more. I had my few meetings with the nutritionist. Basically, just do your research. Just do a lot of, your own research and choose someone that you're comfortable with. I loved Dr. Andrade. He was very kind. And if you have any other, questions, like I said, just let me know. So from start to finish, it was a great experience, and I am happy to answer anything that any questions that you have. And I think I'm going to do a couple more videos, like documenting what my first few weeks were like. I don't know, because I'm already at the almost 9-week mark. But everything went smoothly. Everything was clean. There was hot water. I only had one nurse that I couldn't really understand. I downloaded Google Translate. That was no problem. I chose the basic package with $3,200 plus the $150 med pack. I took a companion, driver's license, birth certificate. Just trying to go through all the questions that I asked and that I had seen asked before. So I guess that will conclude this video, and if you have any other questions about A Slimmer Me or ASM, just comment down below and I will do my best to answer everyone. Thank you. Have a great day.